I have so appreciated that about nurses that I know and that I have worked with is that um, they they want to get things done. We want to get things done, and if no one else is raising their hand to do it, then when we just kind of jump in and do it ourselves.
Hello, everyone. I'm Angela Rosa DiDonato.
And I'm Marian Leary.
And you're listening to Amplify Nursing, a Penn Nursing podcast supported by the Pinola Fund for Innovation in Nursing.
Amplify Nursing features nurses who are leading the way in science, policy, and innovation.
Our guests defy stereotypes, define practice, and disrupt convention.
We highlight the breadth and depth of nursing influence on society by amplifying nurses who are pushing boundaries and breaking down barriers to build a new paradigm. Today on Amplify Nursing, we speak with Megan Mariotti. As the Clinical Innovation Delivery Lead at Verily, Megan uses her nursing experience to bring healthcare innovation to scale. A pediatric nurse practitioner by training, Megan has worked to improve quality and health outcomes throughout her career. In this episode, Megan talks about her thoughts on innovation, overcoming barriers, and the opportunity for nurses to change the landscape of healthcare.
Thank you so much for agreeing to talk with us today.
Oh, well, I mean, I want to thank you for starting this podcast. I think it's a really great way to learn about what other nurses are doing and in some really interesting roles. So thanks to you too.
Thank you. So why don't you tell us a little bit about you and how you ended up where you are now, which is at Verily.
Sure. So I grew up in a family of a couple of different healthcare professionals. My dad is an orthodontist. My mom is an audiologist. I have a couple of aunts, my mom's sisters, who are nurses. And my brother ended up going on to become a physician. So I sort of I grew up surrounded by people in the healthcare profession. So it wasn't probably a big surprise when I decided to pursue nursing as a career. I studied at Penn Nursing. I loved it there, and I think one of the things that I was really attracted to about Penn Nursing is that when I went and visited, I saw that there was just so many options that you have when you become a nurse, that you can work in so many different types of settings. You can work with babies, you can work with adults, you can, work in a hospital or in a clinic. And I didn't know exactly what I wanted to do, but I liked that I would get to learn about, taking care of patients in different settings, and then that I would have options. I certainly never thought that one of those places I might end up would be a technology company. I sort of, along the way, I worked as an RN in the inpatient setting. I was at New York Presbyterian Hospital. I was a camp nurse actually for 4 times at camps for overweight kids. And I sort of went on to pursue roles in quality improvement and healthcare innovation. And then currently I work at Verily Life Sciences, which is formerly Google Life Sciences. And it's essentially been, it was Google Life Sciences, like founded in 2013 as part of Alphabet. And it's a company that is developing tools to really collect and organize health data and create interventions and platforms based on that data and insights from that data.
Yeah, that's really cool. It's so it's interesting that you sort of segued through your camp nursing and your pediatric nurse practitioner experience and ended up at Penn Center for Innovation.
Mm-hmm.
So how do you think that position, how did you get drawn to doing what you're doing?
In my current role, do you mean?
Yeah, and yeah.
Yeah, so I think one of the things that I found in certainly when I worked at Penn's Center for Healthcare Innovation, but also in other roles as a nurse practitioner and in roles in quality improvement, I found that, and I think this is probably not news to you, but that it's really hard to scale effective innovation. That setting up pilots and getting started on a pilot is one thing, but then sort of taking a pilot that's been successful and scaling it across multiple locations, multiple different settings is a whole different challenge. And so, that was clear to me when I started doing shared medical appointments at Geisinger for overweight teenagers. So, doing it in a pilot was one thing, but then trying to do it, more broadly across multiple sites was really, really hard. And then when I got to Penn's Innovation Center, I think we were, that center does incredible work around, really well defining problems in clinical spaces and then developing effective interventions to address those. But scaling it, certainly even within the walls of Penn Medicine was challenging, let alone taking it outside of Penn Medicine to other organizations. So one of the things that really attracted me to this role at Verily is, while it's a totally different space. So, I'm working in a company that, we don't actually provide care for patients. We're sort of outside of the direct care space. But we are, what I was really attracted to here is that I think we're, trying to develop technologies that help us to scale effective innovations. And so I think my experience has really helped me to understand some of the challenges to doing that. And, it just really informs the way I think about what it is that we're building.
So in talking about bringing things to scale, I just want to go back a little bit to the shared medical appointments. So,
sure.
So you piloted it and it was fairly successful, and then trying to implement it large scales where you ran into some barriers. What kind of barriers did you run into for something like that?
Well, yeah, so some of them were pretty simple and then some were more complex. And so just in case people don't know shared medical appointments, they're sometimes abbreviated SMAs, SMAs, and they're appointments that you hold rather than just, sort of one-on-one clinician to patient. They're for multiple patients at the same time. So the reason I started them in the first place is that I was meeting with teenagers in a clinic setting on a fairly regular basis to address some of the health challenges and health concerns that were occurring as a result of them being overweight or obese. And I thought a couple of reasons I thought a shared medical appointment would be better than just me meeting with patients one-on-one. One is that just very simply, I could hold shared medical appointments in the evening so that kids didn't have to get out of school to come meet with me on a regular basis. I didn't want to sort of disrupt their schedule because often I was meeting with kids every month to every 3 months, and it's a pretty frequent appointment time. And then, parents had to get out of work and go drive and pick up their kid and bring them into the appointment. So one simple reason was I thought the timing would just be more convenient. The second is I thought people, I think, like to learn from peers and learn things that have been effective, and sort of rather than just sort of me talking to them and, giving them advice, I thought it could be more effective for them to learn from one another. And that's both parents and their children sort of getting to learn. And then the other thing was that there was I had learned that you could get reimbursement for these types of appointments, that you even though it's a group visit, you actually can get reimbursement. So some of the one of the simplest challenges to scaling is you actually have to get a clinician who will stay at night and see patients in the evening. So that was one thing. The other thing is you kind of have to go through some processes for there's like a privacy form and things like that to fill out. So just like sort of little processes to get through. I had to have somebody stay in the clinic at the front desk to check the patients in. And so we had to sort of like keep the building open. It was a clinic in Wilkes-Barre, Pennsylvania that typically closed, by like 5 o'clock, and I was keeping it open later. And then the other thing was just like getting patients to try it. I sort of spent time sort of like, convincing people to give it a shot. So none of those things are huge things on their own, but they're just sort of these small challenges that just make it a little bit more difficult for us to do it all over the healthcare system.
I can imagine there seems to be a lot of coordination that has to go on in a process like that. And like you said, there are a lot of little things that you wouldn't even think of until you run into the problem. Like there's no one at the desk to let anybody in.
I mean, it's so funny, just to go on about that a little bit. I kind of thought I could check people in myself, but that's actually hard to do when you're also, doing all the other things. I wanted to make this work so badly that I thought I could just like do all the roles, but it turns out you actually can't.
Yeah, I've done that. I feel like that's a nursing. I think that's definitely a nursing thing. I feel like we have our hands in so many pies that we just feel like, yeah, I can do that. I can do that. I can do that. And then you realize you're not an octopus and you can't do all the things.
I totally agree, and I have so appreciated that about nurses that I know and that I have worked with, is that they want to get things done. We want to get things done, and if no one else is raising their hand to do it, then when we just kind of jump in and do it ourselves. And I've kind of always done that to some extent.
Yeah, I think it's a function of being the linchpin that holds the whole system together, right? We're typically the one connection to all of the other things. So because we know where to find everything and what everyone else's role is, we start to feel like we can just do it all too. Yay. Anyway, but yeah, it's such a huge challenge. And I think part of the reason why, people get burned out too is trying to do all the things, right? Instead of building a process where you're not doing all the things all at once.
Yeah.
So we've been talking about innovation in general. How do you define innovation? How is it defined in the roles that you've had?
So I think that actually the way that I've thought about innovation has changed over time. It's funny because I would say earlier on in my career, I don't think that I really identified as somebody who's very innovative. I kind of saw people in innovation as people who are just naturally very creative, and I never really saw myself in that way. As I have come to gather more experience in the space of healthcare innovation, and I think the actual point at which I feel like that sort of transition happened for me is when I started working at the Center for Healthcare Innovation. Sort of the center's name itself was had the word in it, and so I sort of started to slowly start to more identify with that word. But I think that what I've started to understand is that innovation isn't just for people who might be born creative. It's actually something that that everyone can participate in, to a certain extent. It's really some of the really important steps I have found in terms of participating in the innovation process is that you have to take the time to really understand what the problem is that you're trying to solve. And when I say that, I mean, it's sort of, there's multiple ways in which we do that. Certainly looking at data to help you sort of quantitatively define what the problem is in a certain space. the percentage of people who have that condition, the percentage of people who, are taking their medications for that condition, for example. But then beyond just looking at numbers, you also have to take the time to talk to, for example, patients who have a certain condition and learn about them and learn about some of the challenges that they're facing and learn about the ways in which they go about trying to, take care of themselves, the barriers that they face to taking care of themselves. And beyond just, and I actually mean that beyond just like a survey, for example, it's like actually like sitting down and having conversations and listening to people. And then also, observing in the clinical setting, sitting back and just watching and taking it in, talking to clinicians who take care of patients in this space. By training, I'm a pediatric nurse and went on to be a pediatric nurse practitioner. But I've worked on projects in the geriatric space and cardiology and endocrinology and certainly outside of the pediatric space and far more specific areas. And I'm constantly learning about the different ways in which care is delivered in different settings and for different patient populations. So getting to really like to understand that problem, I think, is so important for as you begin, innovation or innovating. And then from there, you can, as you better understand what the problem is, I think it sets you up really well to start to design different interventions and then to start to test them in small groups of people, rather than just sort of jumping right from, you understand what the problem is to saying, I know what the answer is, and I'm gonna, this is the answer for everybody, and this is just what we're gonna do. It's sort of a more humble approach of even after you understand the problem, then you sort of, you test different interventions. And frankly, we're often wrong on the first couple of ones that we try.
So how difficult is it not to get discouraged by that?
Well, first, I just have to acknowledge that was a very long answer to a simple question.
That's okay.
But it's so hard to define. I think what I'll just say to try and justify why my answer was so long is that it's just not as simple as I once thought it was. I once just thought it was smart creative people with good ideas, and it turns out it's really more of a process. So you asked, is that discouraging?
Yeah.
I actually have found it to be totally motivating and exciting and really just I'm always learning. So no, I don't think it's discouraging. And the reason I don't think it's discouraging is because while you are taking the time to really better understand what exactly it is, what exactly the problem is that you're trying to solve, you also you can actually move fairly quickly to do all these things. You don't have to take months to go through these processes. It's sort of more it's way more iterative and fast than I expected it to be, for example. So you can very quickly test, interventions with small groups of people using, you don't have to have like all the technology built out perfectly to start testing things. There are sort of ways and approaches that you can use to sort of quickly test something that you're interested in testing, and then learning and iterating. And so it moves quickly. And I think when you do ultimately sort of implement some sort of intervention, you're actually more confident that it's going to work than you might be otherwise.
Yeah, because of the constant testing.
Yes.
Of your hypothesis.
Exactly.
Yeah. So can you explain a little bit about what you did when you worked at the Penn Center for Healthcare Innovation? Like what kind of projects and stuff did you work on there?
Oh, sure. I My role at the Center for Healthcare Innovation was Director of Operations. I started as Assistant Director of Operations and then moved into that role. And I loved that job. I actually really was really sad when I left because it's a wonderful place um, with some great projects going on. So I I got the chance to work on many of the projects that I was focused on were in the employee health space. And so we had a sort of group of projects that were focused on making employees at Penn Medicine healthier. And the other thing that was interesting about that was we were able to pilot programs within the employee population that, if effective, we could think about scaling to the broader Penn patient population. So I can't remember the exact number, but there's something like 30,000 employees at Penn Medicine. And so it's a fairly large population. And we were able to sort of using data better, understand and see some of the common conditions that were prevalent in the population, talking to employees and understanding the challenges they face in accessing healthcare. We were able to develop some programs to help address some of the common issues. So we worked on projects focused on hypertension, high cholesterol, which of course are both very prevalent in the adult population in the U.S., and also things like reducing unnecessary emergency room visits by giving people easier access to sort of acute care virtually. Was another project that was offered, a program that was offered to employees that was called First Call. So those are some of the projects that I worked on, sort of directly. But then in my role, I also had the opportunity to think about things like generally what is the portfolio of projects that we work on at the center, how do we staff those projects, with the team that we had, hiring people to join the team, and thinking about the different sort of skills and experiences that we wanted to bring to the team, and then also just things like culture and so on for the center.
So how did you work with many nurses at the Center for Healthcare Innovation?
We worked with with nurses all the time in every project that we worked on. Nurses were involved in some way. So of course, many of the projects focused on improving care in the inpatient setting, where nurses were always part of, better understanding the problem and then sort of designing various interventions.
Well, considering that there is only two of you there in this big pot of people working on all of this data and coming up with all these innovations, do you see a uniqueness to your skill set that you don't find with people who are not nurses?
I think so. I like to think so. But maybe that's just because I'm talking about myself. I think that I feel like my experience as a nurse has been so helpful for me in every role that I've had. Um, I think one of the specific areas that I worked on in basically every nursing role I've had, I don't think this is unique to me, but I'll just point it out because it's something I've thought a lot about. Is one of the things that has been consistent across the clinical roles that I've had is focusing on behavior change. And when I was a camp nurse, I was working with kids who were overweight. When I was a nurse in the hospital, it was a general pediatric floor, and so I worked with sort of a broader population of kids with multiple different conditions and different reasons that they might be admitted to the hospital. And then when I became a nurse practitioner, I worked also in the weight management space, mostly with adolescents. And in those roles, I think there always was a part of what I was working on where I was thinking about what are some of the barriers that the patient and the family is facing when it comes to making these changes to support their health, be that taking a medication or picking up a medication at a pharmacy, or changing the way that they're eating, or incorporating exercise, or getting more sleep, or just getting to appointments. I think my experience as a nurse helped me to really think about the specific challenges or barriers that people faced in completing those seemingly simple things. And that experience has really helped me as I've stepped into innovation roles. But I say that for myself, but I think that's true for many nurses. I think nurses just think about those things when they're working with patients, and I think it's a really important experience that could help us inform the ways in which we design technologies, and just ways in which we think about changing healthcare delivery.
Yeah, I agree. I think that as we move forward, I think there's a huge space for nursing to participate and really elevate the way we take care of our patients.
Yes, I totally agree. And as I think we're seeing payment models changing, and to sort of paying more for outcomes, than sort of the traditional volume-based payment models. Mm-hmm. I do see this opportunity for nurses to really be a part of that transition, and sort of taking care of populations of patients, be that more remotely, or sort of looking after a population of patients. I really do see an opportunity in particular for nurses to be leaders in that space.
Yeah, I agree. I think we definitely have the skill set for it. Well, Megan, thank you so much for taking the time to talk with us today. It was lovely to speak with you.
Oh, this was so much fun. I love talking about nurses and innovation, and all these fun things happening in healthcare. So I really enjoyed this.
Hello, Marion.
Hello, Angela. How's it going?
It's going well. So today we spoke with Megan Mariotti, as she is the current Clinical Innovation Delivery Lead at Verily, which was originally Google Life Sciences. And it was a really great conversation about innovation and improving clinical outcomes and moving things to scale.
Yes, I am a huge Megan fan. So, of course, she used to work here at Penn Medicine Center for Healthcare Innovation, and so I've had the great opportunity to work with her on some projects. Mm-hmm. And, she really, it was interesting listening to her talk about nurses as innovators and how she never really thought of herself as an innovator nor as creative. And I hear this all the time from nurses. Mm-hmm. And it's crazy to me that we're, one, not educating nurses more formally as innovators, and two, that we are not amplifying ourselves as leaders in nursing innovation, because it's what we do all the time, right?
Right.
And we should be doing that.
Yes, I agree with you. And I think it's the stereotype, and Megan talks about this a little bit, the creative person who's sitting there thinking of all these great ideas, and not the nurse who's at the bedside who's going, I can't get what I need for this patient, so I have to be really creative about who I talk to, where I go, how I find this, how I use equipment that I have to satisfy the need that I have right now, even though that's not what it's quite being used for generally. And they're really creative and innovative things. We're like innovation on the fly.
Oh, for sure. And that's where figuring out how we can get nurses at the bedside who are creating these new workarounds to be able to scale those up. But unless we start training and educating nurses in that mindset, these will be one-off innovations that just get lost as the nurse moves on to something else.
Right.
And so I love that Verily and other health tech companies are starting to bring nurses in on their teams. I mean, I would have loved it a little sooner, but having Megan at Verily and hopefully other nurses at other health tech companies will really begin to harness the knowledge and power that nurses bring to health and healthcare in these areas.
Amplify Nursing is hosted by Dr. Angela Rosa DiDonato and Marion Leary, and produced by the University of Pennsylvania School of Nursing, with special thanks to our Department of Information Technology Services for their assistance. Music for the podcast was created by Harper Leary. The podcast is made possible by the Krista and Rich Pinola Fund for Innovation in Nursing.
Follow us on Twitter at Penn Nursing. Until next time, keep pushing over, under, around, and through. We want to thank you for listening to the Amplify Nursing podcast and remind you to subscribe to the podcast on iTunes, Google Play, Spotify, or wherever you enjoy your podcast listening. And, if you can, please do us a solid and rate and review us as well. It will go a long way in amplifying our episodes.